Hello, and welcome to Nursing Research Tips, a show dedicated to sharing best practices, tips, and other resources within the areas of nursing research and evidence-based practice. I'm your host, Jenny Barrow, Associate Professor of Undergraduate Nursing, who specializes in teaching students real-world content to help transform their future nursing practice. I enjoy taking the boring world of research and EBP and making it come alive for my students. And that's what I intend to do with this podcast.
On today's episode, I have some special guests from my university's undergraduate nursing research and evidence-based practice course. Kylie Boudreaux, Korah LeBleu, Gabriella McClelland, and Amelia Tate are joining us today to discuss their evidence-based practice project. Before they get started with their discussions, I want to let our listeners know that I have shared a copy of the students' evidence-based practice poster to accompany this podcast episode. You can find that in the show notes for this episode. Now, let's turn the show over to Gabriella to get us started.
Hello, listeners. My name is Gabriella McClelland, and on behalf of my other group members, I would like to welcome you to our podcast. We will be discussing the work we have completed in our undergraduate nursing research and evidence-based practice course. The title of our presentation is Chemotherapy-Related Side Effects Influenced by Fasting and Diet in Cancer Patients. And the members of our work group are Kylie Boudreaux, Korah LeBleu, Gabriella McClelland, and Amelia Tate. We are all undergraduate nursing students at McNeese State University in Lake Charles, Louisiana.
Thank you for introducing your team and presenting your project title, Gabriella. Your group has selected a topic that many patients and providers are increasingly curious about: how dietary approaches or periods of fasting might influence the experience of chemotherapy. To help our listeners understand why this area of inquiry matters, Gabriella, can you begin by sharing your problem that your group set out to address and why you believe that it is an important topic to explore?
Chemotherapy is the most common treatment for cancer. It is very effective but can cause uncomfortable and undesirable side effects for the patient. These side effects include nausea, vomiting, fatigue, a decrease in appetite, and even taste changes. When experiencing these undesirable side effects, the patient's quality of life can decrease, and it can make it more difficult for them to continue their treatment. Different non-pharmacological interventions are being used to determine if chemotherapy-related side effects are decreasing or becoming more manageable. Nurses play a vital role in managing side effects and promoting comfort throughout the entire treatment. These side effects can increase patient distress and require nurses to provide additional care, monitoring, and education. While when these side effects are managed, it can cause a decrease in the amount of distress and discomfort the patient experiences. Incorporating non-pharmacological strategies such as fasting could possibly reduce the side effects related to chemotherapy. Known methods that decrease chemotherapy-related side effects include massages, acupuncture, relaxation techniques, and even exercise. Studies are showing a variety of fasting regimens seem to be capable of preventing the undesirable effects of chemotherapy. Although these studies suggest that side effects could be prevented, current evidence is limited and more research is needed on the topic.
Okay, Gabriella, thank you for laying out that background so clearly. The side effects you described, changes in appetite, weight loss, and significant nausea, can be extremely challenging for patients undergoing chemotherapy. Exploring non-pharmacological strategies, such as different fasting regimens, offers an interesting avenue for potentially improving comfort and reducing treatment-related discomfort. So to guide your team's investigation into this topic, you developed an evidence-based practice question. Amelia, can you share the question that your group created and then how you used it to shape your research process?
Now that we have established the significance of this evidence-based practice topic to the nursing profession, I want to share our group's evidence-based practice question with our listeners. We crafted our evidence-based practice question in the PICO format. Our population is patients who receive chemotherapy. The intervention is fasting. The comparison is no fasting or standard eating practices, and the outcome that we are measuring is reduced chemotherapy-related side effects. As a whole, our evidence-based practice question that guided our literature search in our project topic was, in patients receiving chemotherapy, does extended fasting before chemotherapy administration compared to no fasting or standard eating practices reduce chemotherapy-related side effects?
Thanks for sharing your group's PICO question with our listeners, Amelia. This question served to focus your group's investigations into the literature. Can you tell us more about how you used the PICO question to help you find published research studies about your selected topic?
While researching, we used our group's PICO question to create keywords to search the following university databases: CINAHL Complete, Medline, and PubMed. Some of the keywords that we used for our searches included chemotherapy and fasting, chemo or cancer treatment, and fasting or no fasting, and side effects or adverse effects, harmful effects, complications or risks, chemotherapy symptoms, and fasting or no fasting. We set specific search limiters on our searches, including it had to be within the past 5 years, the articles had to be peer-reviewed, full text, they had to be meta-analysis, it had to be a clinical study, and it had to be a research article. Some of the things that went wrong were that there were many limitations due to lack of research on the topic and lack of sufficient evidence to support a correlation, since there wasn't much research done on the topic.
Korah, thank you for walking us through your search process. It sounds like your team used thoughtful keywords and appropriate limiters, but that you still encountered the challenge of limited research on this topic. That's something that often happens in an emerging area of practice. Even so, the studies that you did find offered some meaningful insights worth considering. Now, Amelia, let's turn back to you. Can you tell us more about the key findings that your group identified from the available evidence?
After conducting our literature search using the methods previously described, we sorted through the study articles to find high-quality studies that specifically addressed our evidence-based practice question. Each group member was responsible for critically appraising one study article, and we synthesized the studies into a group synthesis table to get a bigger picture of the state of the science surrounding our topic. We found important key evidence throughout each study that particularly addresses our topic. The first piece of evidence that we concluded was that all of the articles researched were experimental designs, which indicates that valid data was collected. This also allows a firm cause and effect analysis of the data, a control group from which to compare, and repeatable results. Another piece of evidence that was discovered was that body weight was significantly decreased when the subjects participated in a fasting diet. Because of the effects of chemotherapy, it is common for patients to have a decreased appetite, which may lead to decreased body weight in itself. When adding a fasting diet, this further decreases body weight. Next, we concluded that there were decreased levels of chemotherapy toxicity in those who fasted. This is because the cancer cells become more sensitive to treatment and allows healthy cells to become more resistant to chemotherapy. We also concluded that all of the studies that we researched were conducted outside of the United States, and that most of the studies required female participants. This indicates that if we want to know more about chemotherapy side effects in a nationwide sense, there should be more studies conducted in the United States using participants that are both male and female. We also found that each study indicated that a fasting diet reduced the effects of chemotherapy and improved the patient's tolerance to chemotherapy by making cancer cells more of a target since they are deprived of glucose. It can lead to increased tolerance from patients because fasting reduces nausea and vomiting associated with chemotherapy. Fasting also helps the body repair damaged cells, which can improve recovery after the administration of the chemotherapy. Finally, 2 of the study's research suggested that a keto diet may decrease the effects of chemotherapy by limiting chemotherapy-induced thrombocytopenia. This complication leads to low platelets in the blood, which can cause complications such as increased bleeding when surgery is planned to remove a tumor. A keto diet allows the body to go into ketosis, which is an unfavorable environment for cancer cells, since cancer cells rely on glucose to grow and survive. With a keto diet, the body burns fat and reduces glucose levels in the body, which starves the cancer cells and slows their growth.
Thank you for highlighting those findings, Amelia. It's encouraging to see that the studies you reviewed used experimental designs, which allowed for stronger conclusions about whether fasting may truly influence chemotherapy-related outcomes. The decreased levels of treatment toxicity you mentioned are certainly noteworthy, even though the evidence is still limited and primarily based on studies outside of the United States with mostly female participants. With these findings in mind, the next step is to consider what this can mean for clinical practice. So, Kylie, can you share the nursing implications your group identified based on the current evidence?
Based on the information our group reviewed, we noted several key implications for nursing practice. Our findings highlight that fasting before chemotherapy may help reduce some of the treatment side effects such as fatigue, nausea, and vomiting. However, because each patient's nutritional needs and health status are different, nurses play an important role in providing individualized care. One major implication is that nurses should educate patients about both the potential benefits and the risks of fasting before chemotherapy. This includes discussing whether fasting is safe based on their diagnosis, current health, and treatment plan. Another implication is the importance of individualized care planning. Not every patient will respond to fasting in the same way, so nurses should collaborate with dietitians, oncologists, and the patient to create a plan that meets their personal needs. Lastly, staying current with emerging evidence is essential. As more research becomes available on fasting and diet and cancer care, nurses should keep up to date so they can provide accurate evidence-based guidance to patients. These implications are especially relevant for oncology nurses and nurses working in the outpatient chemotherapy centers, where they have the opportunity to educate and support patients throughout their treatment journey. By applying this knowledge, nurses can promote patient safety, improve treatment tolerance, and enhance quality of life during chemotherapy.
Good job, Kylie. Thanks so much for outlining those practice considerations. You emphasized an important point, which is patients undergoing chemotherapy have highly individualized nutritional needs. And any dietary change, including fasting, must be carefully assessed and taught by nurses and other interdisciplinary team members to ensure safety. Beyond clinical practice, your findings also raise important questions about future study needs. So, Kylie, can you share the research implications that your group identified?
There is still some knowledge gaps in the published research surrounding our topic. Because of this, our group developed several implications for future research. Although current studies suggest that fasting or specific diets such as ketogenic or fasting mimicking diets may help reduce the side effects of chemotherapy, the research is still limited. Many of the studies were small and conducted outside of the United States, which means the results may not apply to all populations. To strengthen the evidence, larger randomized controlled trials are needed. This would help confirm whether fasting truly helps improve chemotherapy tolerance and could provide more reliable data for healthcare professionals. It would also be helpful for future research to include a wider variety of cancer types and patient demographics to make the findings more generalizable. In addition, researchers should explore the long-term effects and safety of fasting during cancer treatment. Understanding how fasting impacts overall health, recovery, and quality of life beyond chemotherapy is essential before it can be widely recommended. Overall, future studies should aim to develop clear evidence-based guidelines that nurses and healthcare providers can use to safely educate and support patients who may want to use fasting as part of their cancer care.
Okay, so your group has given us a lot of excellent information about the current state of the science surrounding your selected clinical practice topic. After all the research studies your group reviewed, including considerations for study weaknesses and continued gaps in the present literature, what was your group's overall literature-based answer to your original PICO question?
After all of the research studies that our group reviewed, we were able to determine an evidence-based answer to our evidence-based question. While some research shows that extended fasting can decrease chemotherapy-related side effects, there was not enough evidence to support a strong correlation. Most of the studies showed that fasting in conjunction with chemotherapy made the chemotherapy more effective in treating cancer. A few of the studies mentioned the reduced chemotherapy side effects when fasting, but the correlation between the two is not significant enough to definitively say that fasting decreased chemotherapy side effects. The fasting supports the chemotherapy in treating the cancer. Evidence-based practice questions are very important in nursing because they can ensure good nursing care by making sure that nurses are using the most up-to-date practices. This can also help me in my future nursing care by helping me to ensure that future cancer patients can mediate their symptoms and decrease the side effects of their chemotherapy. I can also use this to help teach patients how to support their chemotherapy by making their chemotherapy possibly more effective by using fasting. But overall, there was not enough evidence to support that fasting decreased chemotherapy side effects. The research was mainly focused on fasting making chemotherapy more effective.
Thank you for bringing everything together so clearly, Korah. Your summary highlights an important reality in evidence-based practice. Even when early research shows promising trends, such as the potential for fasting to reduce chemotherapy side effects, we still have to be cautious when the overall evidence base is so small or with such a limited scope. Your group's work demonstrates the importance of questioning, searching, and critically appraising the literature rather than relying on assumptions or trends. I'm proud of the way that each of you engaged with this project. You learned firsthand how challenging it can be to navigate an emerging area of research. And yet you also gained valuable insight into how those skills will support your future work as registered nurses. Whether you're educating patients, collaborating with providers, or evaluating new practices on your units, the ability to interpret evidence thoughtfully will serve you well throughout your careers. And to our listeners, thank you for joining us for this episode. Nursing continues to evolve, and staying engaged with the research process helps us provide safer, more informed, and more compassionate care.